Good afternoon, everybody. I know it's late in the day, so I'm going to start with a little audience participation, but there are no prizes, so I'm going to tell you that ahead of time. I want to ask two questions. The first is, who in the audience is familiar with a disease called trachoma? It's not bad. And how about a medicine called Zithromax or azithromycin? Pretty good. I'm going to spend the next few minutes telling a story to you about the medicine Zithromax, the disease trachoma, that is grounded in the history of Pfizer and our work to address infection. And our story begins on the streets of Brooklyn in the late 1800s. And don't worry, I'm not going to take you through every day of our history. You would be here all night. And the company was started on Bartlett Street, and by two cousins who immigrated from Germany. One, a chemist, the other, a candy maker. And you may think that a strange combination, but their first contribution to global public health was putting a candy coating on deworming medication, which meant that children were more likely to take their full course of therapy. Fast forward several decades, and the next contribution involved penicillin, another antibiotic. It was a wonder drug. We did not invent it. But what we did have was fermentation technology, and no one had figured out how to mass produce that product. Well, Pfizer put its head together, used our fermentation technology, and we were the first to unlock the ability to mass produce penicillin. And if you walked the streets of Brooklyn in the 1940s, you would see our plant working overtime because it was open to ensure that we had enough penicillin for our troops to take it ashore on D-Day. Ever since that day, our scientists have continued to work to discover, develop, and bring to market medicines that help people live longer and healthier lives. And we're particularly proud of the work we've done to address infection. In fact, Pfizer now has one of the largest and most diverse portfolios of anti-infectives of all of the companies. 80 plus products. 45 of those are on the essential medicines list. You've heard the essential medicines list referenced this afternoon. That's the list that's basically the products that we believe, that the World Health Organization believes, that experts believe, offer the best opportunity to keep communities healthy. And azithromycin, or Zithromax, is one of those. Now, Pfizer and Zithromax came together in the late 1980s. We were the first company to conduct the clinical studies necessary to file for registration first in the United Kingdom, then in the United States. And along that way, we discovered something. It looked like that medicine was effective at treating a disease called trachoma, but we weren't sure. So we partnered with the Edna McConnell Clark Foundation to conduct confirmatory studies in 3 endemic trachoma countries. And what we discovered was that a single dose of the medicine was effective at treating the active infection that causes trachoma. That led to a 20-year commitment, and now counting, to eliminate that disease. So some of you in the audience, and many of you might be our partners in this work, know what trachoma is. But for those of you that don't, 163 million people are still at risk for it. It's the #1 cause of preventable blindness. And it is a disease that affects the communities living at the end of the road. Those that don't have access to clean water, sanitation, physicians, or nurses. And it's incredibly painful. You get a repeated infection in your eye, and over time, you develop scar tissue, and your eyelashes begin to turn inward. And they're not soft anymore. They're hard. They're almost like nails, scraping the cornea and leading to blindness. And as you can imagine, that means that you don't have any future. If you can't see, it's very difficult in these communities to take care of your family. So we also knew at the time that we did the confirmatory studies that Zithromax provided a really unique opportunity because the standard of care was antibiotic ointment that needed to be applied 3 times a day in the eye for 6 weeks. Now, I think about that with my children, and I'm sure all of you in the audience who have children, it is virtually impossible to get them to do anything, let alone put antibiotic ointment in their eye. Imagine doing that if you were a community at the end of the road, a person who didn't have access to clean water. It's incredibly challenging. We also knew from that work and from our partners and from the World Health Organization that the medicine alone was not enough. We needed a full, comprehensive public health strategy. And we affectionately in the trachoma community call it SAFE. Surgery for the advanced cases of the disease where they can flip the eyelid back, antibiotic for the treatment of the active infection, which is our contribution, face washing and education for young kids so they understand how to take care of themselves and wash their faces and not spread infection, and environmental development, which is around sanitation and clean water. So in 1998, we responded to the World Health Organization's call and launched the International Trachoma Initiative. Fast forward to today, we're 100 partner organizations strong. I like to call us a merry band that is focused on eliminating this disease by the year 2020. And as I said, it involves more than just our medicine. But we're very proud that Pfizer has donated more than 740 million doses of our antibiotic Zithromax to contribute to the effort. Thank you very much. And along the way, and a theme that I think you've heard about today, is the use of scientific and technological innovation to support our work. And so, over the course of these 2 decades, our partners realized if we could just understand more about where the epidemic was, we could be much more efficient in bringing that safe strategy to the communities who need it. And so, led by Sightsavers and a number of our other partners, they launched the Global Trachoma Mapping Project, the largest disease mapping project of its scale and time, using cell phone technology. They collected information at the household level, and that has been transformational for all of us in the trachoma community because it means for Pfizer, we can more effectively target the use of our antibiotic, and for our partners, they can more effectively target the use of the full SAFE strategy. Huge progress has been made. In fact, Nepal in May was the 6th country to be certified by the World Health Organization as having eliminated the disease from their country. And we're thrilled, yes, that is worth a round of applause. And we're thrilled that we've made so much progress. But that mapping work actually showed us something, which is while we have our eyes on the prize of the year 2020 to push as many countries toward elimination, we know that there will be a few countries that won't quite make it. And so today, at Devex World, and earlier this morning, we announced Pfizer's recommitment to providing our antibiotic Zithromax as part of the work toward our goal of a world free from trachoma. And we're doing that just to make sure if countries can't get there by 2020, they know they have the support from Pfizer they need to eventually eliminate trachoma in their country. Now, the other thing that's been interesting about our merry band of partners who's worked so closely together with endemic country governments is that we've observed over the 2 decades some interesting things about children. Children who participated in the trachoma program had better health outcomes. And at the time, that was anecdotal evidence. But recently, the Gates Foundation funded a group of researchers at the University of California, San Francisco. And they did a study and discovered that children who were given 2 doses of Zithromax over the course of 2 years, had more than a 13% reduction in childhood mortality. That is incredible, actually, in this field, and probably worth a pause. And we are very, very excited about it, but cautiously optimistic, because we don't actually understand why. And so what we've also committed to, the Gates Foundation and those researchers, is the product that they will need to continue the work, to understand the role that Zithromax might play in improving childhood health. So we'll stand by and let the science guide us as they continue their work. Now, we've had a good news story so far, and I don't know through the course of the day if antimicrobial resistance has come up as a point of discussion, but it should, because we're talking about Pfizer's commitment to antibiotics, to anti-infectives, and against a backdrop of a world where we're seeing more resistance. Pfizer has a comprehensive approach to address this, but I want to hit on 3 things for you. First, for Pfizer, our scientists are working every single day to bring more antibiotics to market so that we have more tools in our arsenal. 2, we are working with providers and patients to talk about appropriate use. You shouldn't be taking an antibiotic unless your healthcare provider has prescribed it for you. 3, we are supporting an open source platform for global surveillance. This has been underway for more than a decade. Anybody can get access to it, and what it's teaching us is about where there are pockets of resistance so that we can be better equipped in dealing with it. And for our work in trachoma, we have historically and will continue to be guided by a technical expert committee. Scientists and physicians make the decision for us about where and when we distribute the antibiotic in partnership with the ministries of health in the country to ensure that we have no unintended consequences from our work. Now, I've told you the story of Zithromax and trachoma and Pfizer's history in anti-infectives, but if our medicine could talk, it would tell you a different story. It would tell you the story of our colleagues in Puerto Rico who came to work 2 days after Hurricane Maria and started up the line that produces Zithromax because they were so committed to the work of our public-private partnership. It would probably tell you about the trains, planes, automobiles, yes, bicycles, that is Zithromax on a bicycle, that it takes to its final destination. And it would tell you probably about along the way the beautiful sunsets, the rivers, the streams that it sees. But most importantly, it would tell you about those communities who are at the end of the road. The communities whose parents share the same goals all of us share, which is healthy, happy children. And it would tell you the story of impact of a public-private partnership toward the goal of a world free from trachoma, a world a little more equitable and a little more just for the next generation. Thank you very much.